catch up, but good afternoon, good evening. My name is Amy Rosenfeld. I am the program coordinator for Northern Westchester Hospital's Center for Healthy Living. You are joining us for our Breathe Easier program. Thank you so much for joining us today. I have with me our clinicians and specialists. First off, I'd like to introduce Jennifer Lucas, one of our star respiratory therapists and program coordinator of our smoking cessation program. Next, I have with me Linda Caffrey, a nurse practitioner extraordinaire and our lung cancer screening navigator for Northern Westchester Hospital and Phelps Hospital. Ladies, thank you both for joining us today. Today, we're going to talk about tips to quit smoking and steps to live a cancer-free life. Today is the Great American Smokeout, American Cancer Society's Great American Smokeout, and there's no better day than today to start quitting or to get started on your plan to quit. So what are we going to do today? Today, in order to learn about how to quit smoking and how to live cancer-free, we're going to play a trivia game together. And here's how to play. A trivia question will pop up in your Zoom poll on your screen. So a little box will pop up with the question. Give the answer your best shot. The questions and the answers to the questions will be completely anonymous. No one will know the answers, but it's fun to see how many facts you know about smoking cessation and lung cancer and learn as we play along. So to start us off, one more piece of instructions. If you have any questions along the way, I encourage you to put it in the chat function or the Q&A function, whatever you prefer, and we'll answer questions at the end. Again, thank you so much, and we'll get started with our first question. Here we go. All right. Can everybody see that box? Ladies, can you see that?
Yes.
Excellent. All right, Jen, take it away.
Which of the following are ingredients in cigarettes? Nickel, arsenic, formaldehyde, or vinyl chloride? Let's give it your best shot.
All right, let's see. Here we go. Results, Jen.
Awesome.
Yeah.
So 100% of the people picked arsenic, which is true, but the answer is really all of the above. Nickel, arsenic, formaldehyde, and vinyl chloride are all in cigarettes. Sort of scary, but also just to touch on some other ingredients that are normal everyday ingredients that you might be aware of. There is acetone, which we all know from nail polish remover. There is tar, like the stuff that they use to put down on the roads. DDT, which is an explosive. Ammonia, benzene, and our good old friend nicotine. They are all other ingredients in cigarettes.
Wow. That brings us to our next question that'll help us to learn a little bit more about exactly what's in a cigarette. Question number 2, Jen.
How many harmful chemicals does tobacco smoke contain? 1,000, 3,000, 5,000, or over 7,000? Let's see.
All right, let's see. We're almost at everybody voting. Let's see. All right. Here we go, Jen, the answer?
Oh, wow, we're 50-50. So there are actually over 7,000 chemicals to date that have been identified in cigarettes and cigarettes. An interesting little fact, just 5 years ago, they were only able to identify around 5,000. So just in 2 years, either they have added more chemicals or they have done a better job in trying to identify what is in there. Over 7,000, wow. Crazy.
Wow. All right, question number 3. Jen.
How many of the chemicals found in tobacco are proven to cause cancer? 1, 10, 35, or 69?
So we know that there are over 7,000 of them. How many of them are found to proven to cause cancer? Let's see. Here you go.
Also 50-50. I love it. So 69, there are 69 chemicals that are proven, guaranteed 100% to cause cancer. They have been linked. They are being followed by researchers. So 69 out of 7,000 you wouldn't think is too bad, but that's still 69 that are increasing your risk of having to develop cancer.
And if they're continuously finding new chemicals or changing the formula, it could be uncounting. Is that correct?
Absolutely.
Wow.
Wow.
All right. Question number 4.
Number 4, what does 30-pack year smoker mean? I've smoked 30 packs of cigarettes. I've smoked for 30 years. I've smoked 1 pack of cigarettes per day for 30 years. I've smoked 2 packs of cigarettes per day for 15 years, or both C and D.
That's a tricky one.
That is.
Best shot.
Let's see what everybody says. Give them just another minute to vote. All right. Sharing results. Jen, what's the answer?
That is correct, both C and D. So your pack year history depends on how many cigarettes you have smoked per day for how many years. And what your pack year history depends on whether you qualify to have the lung cancer screening. So we're going to get into that in a few minutes.
All right. Question number 5. Audience is doing pretty well, I have to say.
Very good.
Rest.
Question number 5.
All right, so this one is a true or false. Vaping or e-cigarettes is a safe alternative to smoking. True or false?
All right, here we go. Audience says.
False. Very good. So interesting fact, e-cigarettes have been used for years as an alternative to smoking. It was actually created to get people to try and stop smoking. But what's happened is over the years, so much nicotine has been put into these vapes, these e-cigarettes, and then they have become flavored, and people are smoking or vaping or e-cigaretting more than they were prior. So it is definitely not a safe alternative to smoking.
And that's definitely confusing based on what the marketing from these companies has been, the mixed messaging. It's definitely something that the public has to catch up with and understanding.
Yep, absolutely.
All right, question number 6. Jen?
True or false? Marijuana smokers are at a risk for lung cancer.
This one's also potentially a tricky one for some. All right, and the answer is.
So it's funny because this question really stumped me, because there hasn't been a lot of research on whether people who just smoke marijuana have developed lung cancer. It's definitely something that needs to be done. But the fact remains, anything that you smoke, anything that you are putting into your lungs has the potential to cause damage, whether it's cancer or COPD, emphysema, any type of lung disease. So although it's not 100% fact that it is at risk to cause lung cancer, it is still doing damage to your body and still should not be done.
Okay. Question number 7, Jen?
True or false? Nicotine causes cancer. This is a question that I get a lot, so I wanted to present it.
All right. Looks like we also have a 50-50 split for this one.
Awesome. So another interesting fact, nicotine has not been found to cause cancer. Nicotine is the most addictive ingredient that is found in cigarettes and vapes and e-cigarettes, but it has not been found to cause cancer. Tar is also a big ingredient in cigarettes, and tar has been directly linked to cancer. Tar is one of the ingredients that provides flavor to the cigarettes. So the higher the tar in the cigarettes, the more likely you are to develop cancer. But don't be fooled, because if you are smoking low tar cigarettes, you still have these 68 other factors out there that are known to cause cancer. So best to not use any of them.
And is tar the stuff that turns your lungs black? Like when you see those notorious pictures, is that what makes the color of your lungs black from the tar?
It's a combination, because what the tar does when you are smoking is it goes into your lungs and it sits at the alveoli. And because those alveoli tend to get filled up, per se, and blocked with the tar, it reduces your ability to oxygenate. But the chemicals itself goes into your airways, and that causes like a fibrosis, and that causes scarring, and that causes the damage to the lungs. So both of them will look black on x-ray.
Interesting. Okay, question number 8, Jen.
True or false? Quitting smoking leads to weight gain.
Sure, another common question.
Very common.
Okay, and the answer is?
It is. So believe it or not, it's not true all force.
A tricky one. You tricked them.
Sorry. So cigarettes have actually been known to be an appetite suppressant. There's nothing specific that says that it is. People say that they tend to not eat as much when they are smoking, and that they tend to eat more when they are not smoking. So the Northern Westchester Smoking Cessation Program, we not only work on getting you to stop smoking, but we also encourage exercise. We give you little things to do at home, and we also discuss healthy eating. So it's a fully combined program to try and minimize weight gain and prevent it as best as possible.
Great. It's great that it's so holistic. All right, Jen, and before we segue into talking about the smoking cessation program and how it works, your final question.
True or false? There are 3 FDA approved medications or therapies that can help somebody stop smoking.
Okay, and the answer is?
Wow. So 100% of the people said true. And believe it or not, there are 7 FDA approved medications / therapies that are safe for use to stop smoking. Nicotine patches, nicotine gum, nicotine lozenges, the nicotine inhaler, the nicotine nasal spray, Chantix, and Zyban. So Chantix and Zyban are oral medications, and those 2, as well as the nicotine inhaler and the nicotine nasal spray, need to be prescribed by a physician, and you need to be followed by a physician.
Okay, so based on this information, if someone is interested in learning more about the smoking cessation program, maybe you could just give our audience a little bit of a summary of what exactly it looks like and how it works.
Definitely. So we offer a free smoking cessation program. Right now it's being done virtually. We were meeting in person, but right now we are doing it virtually. It is group sessions. We get to learn about each other. We get to recognize each other's triggers, put some ideas into play. We create an individualized plan for every person. You know, one of the things that I say all the time is everything does not work for everybody. So we find out what is best for you. We put a plan in place. You are welcome to come to every class every week for as long as you need to come. We have people that I have worked with for over a year until they finally stop smoking. My responsibility and my goal is to ultimately make every single participant tobacco-free. And as long as you are willing to put in the time and willing to make room for me in your life, then I will be there for you until you become tobacco-free.
That's so supportive. And does it include vaping cessation as well, or is it exclusively smoking?
Nope, we do vaping cessation as well. A lot of the triggers still apply. A lot of the methods to stop still apply. Vaping has the nicotine in it, so if nicotine replacement is something that people choose to use, we teach you how to use it and use it properly and safely. You know, we get your physician involved to see what's best for you. But the best part is it's free. It's available to you. I am available, I'm not going to say 24/7, but I'm available pretty often by phone, by email, text message, and we will do whatever we need to do to get people to stop smoking. So the thing is, today is the American Cancer Society's Great American Smokeout, so today is the perfect day to make that decision to stop smoking. I'm going to give you my information, plus you also see the phone number on the screen, but I have an email address. It is nwhsmokingscessation@northwell.edu. So you are welcome to email me with any questions, any concerns, or if you want to get started, let's do this.
And after the program, I will say there will be a survey that's automatically launched, and there will be an option to say that you would like to speak with Jen or schedule an appointment or ask questions. And if you put your name and contact information in that box, Jen will reach out to you tomorrow. So that's definitely another way that you can get a response and learn more about the program today. Thanks, Jen. You probably had a lot of success stories over the years, given how patient-centered and supportive you are.
It's interesting because I just reached out to one of the staff members who, as of 2 days ago, was 7 years tobacco free. And I sent him a text message and he responded so shocked that I actually remembered, everybody that participates who quits. And even if you don't quit, everybody is very important to me. If you have a minute, I just wanted to share a little story about one of my participants. Her name is Melissa. Melissa is an amazing woman. She had both of her parents die from lung cancer. Her father died at a young age and her mother died a little bit older than him, but she watched them. She took care of them. She watched them struggle. She still continued to smoke. It got to the point in her life where she was doing everything right. She was physically active. She was eating properly. She was going to her doctor's appointments, and she was still smoking. She tried, I believe the number is 8 times, and failed every time. And that's okay, because I don't see it as a failure. Every single time that you try and stop smoking, every cigarette that you do not put into your mouth is a success. So she saw a flyer in the doctor's office. She gave me a call. We spoke on the phone for probably about 20 minutes, a half hour. And then she joined our first session in person. I am so happy to say, after however long it took, whether it was 6 months or a year, she is now 4 years tobacco free. We still communicate. She is a huge inspiration to others. I've actually had her come back to classes when we were doing it in person to speak to others, to give some inspiration that it takes work, it's hard, but you absolutely can do it if you stick to it. And I reached out to her prior to this webinar, and she said that if there's anybody that wants to have a conversation with her, she is more than open to it. So if you would like to, you can put the information in the chat or in the survey, and we will get you connected with her.
Wow, what an amazing person, and what a testament to your work as a clinician. Thank you, Jen.
Thank you.
All right, so Linda, it's your turn.
Hi.
Our next trivia question, we're going to transition over to learning a little bit more about the effects of smoking. So question number 10, Linda.
Okay, smoking cigarettes and secondhand cigarette smoke are both risk factors for lung cancer. True or false?
All right. Audience says, the majority of them say true. Linda, what's the answer?
That is true. Yes, both smoking cigarettes and secondhand smoke are risk factors for lung cancer. So for all of you smokers out there, maybe if possible, smoking outside or not around others would be very helpful, especially if there's little ones around.
So what you do, your behavior impacts others.
It does. It does.
Yes.
And we want to protect our young, and if possible, think about that.
Yes.
Okay, question 11.
Yes.
What are uncontrollable risk factors for lung cancer? Radiation therapy to the chest, air pollution, personal or familial history of lung cancer, or all of the above?
All right. An audience says all of the above. What's the answer? Yeah?
Very good. All of the above. That is correct. As comparison, controllable risk factors would include smoking cigarettes, cigars, or vaping. So if you are currently smoking, consider quitting today on the Great American Smokeout.
Definitely. All right, question number 12.
Okay, this is a good one. How many people are diagnosed with lung cancer every year? Less than 100,000, 100,000, 200,000, or more than 200,000?
All right, looks like the audience is a little more split on this one.
Hmm. Let's see
Let's
what they
see.
say.
But majority says more than 200,000. Linda, what's the answer?
And that is correct. A huge amount of people that are diagnosed with lung cancer. The American Society reports it's 228,820 people every year that are diagnosed. So
Wow.
let's quit smoking on the Great American Smokeout.
Definitely. Okay, question 13.
Okay, true or false? Lung cancer in early stages often have no symptoms.
Hmm. Let's see what people say. All right. Majority of the audience says true. Linda, what's the answer?
That is correct, true. Um, Unfortunately, lung cancer is a silent killer. In its early stages, there are no symptoms, and it can spread and become more concerning as time goes on. And oftentimes, it can take years for lung cancer to become apparent and for a patient to start having symptoms. What if they start having symptoms? They're often diagnosed at a late stage where there's less that we can do. Therapies are improving, and the prognosis is improving for later stage lung cancer patients, but we want to find lung cancer at an early stage before you become symptomatic, when we can greatly extend your lifespan.
Yeah, and we're definitely going to talk about how exactly the lung cancer screening works. But before we get to that, a couple more questions.
Okay.
Question 14.
Okay, what percentage of patients who die from cancer die from lung cancer? 5%, 10%, 15%, or 25%?
All right, let's see. The majority of our audience says
Ah,
25%.
very good, folks. And that's correct, 25%. So unfortunately, more people die from lung cancer than breast, prostate, and colon cancer combined. So that's a huge percent.
Wow.
We can try and reduce that.
That is a very
Wow.
scary fact.
Yeah.
Very much so. All right, question 15.
Okay, this is true or false. All lung nodules are cancer.
Okay. And the audience says, they say false. What do you say, Linda?
Okay, very good, very good. We have a great audience tonight. That is correct. Not all lung nodules mean cancer. Sometimes the nodules are benign. That means they're there, they're not growing, they're sitting there, and they're not doing much of anything. Sometimes they mean nodules mean inflammation or infection or old scarring, and less frequently lung cancer.
All right. And question 16.
Okay, which of the following types of patients are at high risk for lung cancer and should therefore have an annual lung cancer screening? Age 55 to 77, a smoking history of 30 or more pack years, a former smoker that is quit less than 15 years ago, asymptomatic for lung cancer, no personal history of lung cancer in the last 5 years, or all of the above.
And our
Long,
audience
long question.
says, they say all of the above.
These guys are great. And that's right. These patients are at risk. So if you're 55 to 77 and a 30 or more pack year smoking history, or have quit within the last 15 years, you are at higher risk for lung cancer.
All right. Then in terms of screening, before we get into talking about that, last question, Linda.
Okay, what percentage of patients who are eligible for lung cancer go for lung cancer screening? 10%? No, I'm sorry. 100%, 50%, 25%, or less than 15%?
Okay, looks like the audience is a little more split on this.
Okay. I
There's
see.
the majority say less than 15%, but some say 50%. What's the
Okay.
answer?
I would like to get to 50% patients screening. Unfortunately, only between 5 and 14% patients who are eligible go for screening. We have so
Wow.
many more people that we can get screened for an early diagnosis of lung cancer. Again, where we could do some surgical intervention and extend one's lifespan dramatically. So please get the word out. We want to increase that number 50%. I'd like it to be 100%.
And so that maybe through this program, we can talk a little bit about that and how we can get the number up. So can you
Okay.
explain to us what the goal of lung cancer screening is and how exactly the lung cancer screening program at Northern Westchester Hospital and at Phelps Hospital works?
Absolutely. So our goal for lung cancer screening is to find lung cancer at an early stage. We're looking for nodules that are suspicious for lung cancer. Again, not all nodules are lung cancer. They can mean other things. But when we look at the low-dose CAT scan and we look at the images, we're looking at nodules that are suspicious. We look at the size and we look at the density of the nodules. Based on that, there is a criteria that they fall into. If it's more suspicious, then we may ask you to go for some additional testing. If the nodules are there, but there's not a high suspicion that they're cancer, we're going to want you to come back in another year so that we can scan you again and take another look. So lung cancer screening is done with a low-dose radiation CAT scan. It's a lower dose radiation than a regular chest CAT scan, higher than a chest X-ray, but also less than what you are exposed to annually to the environment, which I think is interesting.
Very
Now, radiation is radiation. It does not dissipate. However, the benefit of lung cancer screening to determine that early stage of lung cancer versus the risk of radiation, the benefit wins out. Absolutely. So there is a false positive rate in lung cancer screening where you may need to go for additional testing. That's around 10 to 14%, which is about the same as a mammogram. I would love to get as many eligible patients screened as possible. My number is on the screen there. It's 833-586-4727. I work out of both facilities, Northern Westchester and Phelps. Whichever is your preference, you can be scanned at. Lung cancer screening process is very easy. You call the number, there's a brief survey. We ask you a number of questions. If you're eligible, the concierge service will schedule you with an appointment with me. That appointment is a telephone or a telehealth appointment. Right now, because of COVID and the hospital's preference, which is a protective measure, everything is, our shared decision-making visits are done telephonically or by telehealth. We discuss your risk factors. We get into detailed smoking history. We talk about smoking cessation. We talk about the pros and the cons of lung cancer screening. And then we talk about what the process is and what will happen after you're screened. We'll discuss our team meetings that occur with our specialists. They include pulmonologists, radiologists, and thoracic surgeon. If you're not found eligible when you call the concierge service, that information will be sent to me anyhow. I will review it and reach out to you and discuss with you what your next best options are. Um, for lung cancer screening, when you go to the hospital at either Northern Westchester or Phelps, it's a very simple process. You are screened for COVID symptoms prior to entering, and your temperature will be checked. You'll go down to the radiology department. The rooms are thoroughly disinfected in between each patient. Both facilities are scheduling patients earlier in the morning and later in the afternoon, and that helps reduce exposure to foot traffic, thereby reducing the risk to exposures for COVID. It's a low-dose radiation CAT scan. If you wear a shirt that does not have metal on it, you won't have to change into a gown. You'll lay down on the table, put your arms above your head, take in a deep breath. You'll slide in and out of the machine that looks like a big, giant open donut, and the test is done. Truthfully, parking and checking in is going to take longer than the scan itself. The scan is not invasive. There is no dye that's injected.
So it sounds like it's a pretty non-painful, relatively easy process.
Yes.
And is it covered by insurance for most people to have a screening if they're eligible?
Yes, for most people, Medicare covers, and most insurances, as long as one meets the eligibility requirements, will cover for lung cancer screening.
Mm-hmm. Excellent. So again, the number is 833-586-4727. And again, at the end of the program, there is a survey. And if you wish to be contacted by Linda, put your name and information in that box. It's confidential. Everything is confidential. And she'll reach out to you tomorrow is another way to schedule an appointment. So thank you. It sounds like at this time, the hospital is doing everything it can to keep patients safe, continuing through the screening through the pandemic. Should you
Absolutely.
wait or should you go?
No, don't
Oh.
wait. You should go. You should go. There's, unfortunately, during the first surge, there were people that waited, and that was across the board for all screenings, colonoscopies, mammograms, lung cancer screening. Please don't wait. We want to get you screened. We want to know if there's an early cancer. We don't want to delay it to a point where you start developing symptoms and then you're diagnosed at a later stage.
Yeah.
Good advice. All right, so our final two trivia questions before we conclude tonight.
Okay, here we go. How often should lung cancer screening be done? Lung cancer screening is a one-time test. Lung cancer screening occurs every 5 years. Lung cancer screening is every 2 years, or lung cancer screening is an annual test.
All right, and let's see. Audience says they were listening. Annual test.
We have the best audience ever. That is correct. It's an annual exam, and the studies have shown that patients that do come back for their annual exam benefit most. This allows the radiologist to truly compare year by year what any nodules are doing, whether they're growing, whether they're just sitting there and not doing anything at all. So an annual exam.
So if you fit the criteria, it's just part of your roster. You go to the dentist, you go to your general practitioner, you get your lung cancer screening. It's just something that you schedule every single year.
Exactly. Routine. Come on in.
Routine, exactly. All right, and our final question of the evening.
Okay, final question is, true or false, lung cancer screening and quitting smoking can save your life? I know the audience is going to get this. 100%.
Yes. And they say true.
Yeah.
Definitely.
You betcha. You betcha.
And
So,
I'm sorry, Linda, go ahead.
No, I'm sorry. I was just going to say the life-saving power of early detection just cannot be overstated. When we catch cancer at an early stage, we can have the most impact on prognosis and survival. According to the Lung Cancer Society, annual low-dose CAT scans screening for lung cancer can prevent 12,000 deaths every year. It's a huge amount.
Yeah.
Definitely.
And that's with only 5 to 14% of patients being scanned. Imagine if we were able to get 100% of eligible patients scanned, how many lives we would be able to save.
Exactly.
And
Well,
then
thank you to
Jen,
you both. The two of you are doing amazing work to help our patients. Jen, with it is a struggle. Many of our comments in the chat here are talking about how they may be knowledgeable, but addiction is real and addiction is hard. And you are a service that is for the community, a free smoking cessation program available and supportive to anyone who needs it for as long as they need it. Again, to join Jen's program, it is meets almost every week, right, Jen? Every week, virtually at this time. Today is the best day to take that step, the Great American Smokeout. Again, the number is 914-666-1868, or you can email Jen, nwhsmokingcessation@northwell.edu, as well as put your name and contact information in the box. Same thing with lung cancer screening. Linda is available to take your appointment and answer your questions for either Phelps or Northern Westchester Hospital, whatever is more convenient for you. Her number is 833-586-4727. And certainly at Northern Westchester Hospital, we're here to support you in your wellness. That is what Center for Healthy Living is all about. So I kindly ask you to complete the survey that will pop up on your screen at the conclusion of this webinar. We welcome your feedback to hear what you thought about it. We want to hear about other topics you'd like to hear from this department. We'd love to provide them for you. And again, any referrals, any questions you might have just to learn more about either the smoking cessation or lung cancer screening programs, feel free to put your information in the charts. I want to thank you for joining us this evening. I believe answered all of the questions in regards to the summary of the program and the polls made available afterwards. I'll see what Zoom's capacity is. If we're able to provide that to our attendees this evening, I'm happy to do that. I will get back to you about that. And we hope we answered all of your questions and gave you all the information you were looking for. Thank you so much and have a wonderful evening. Thank you, ladies.
thank
Thank
you.
you.
Thank you, Amy. Thank you, Jen.
Bye.
Bye.